Now, we'll quickly try to look at the next stuff here, which we'll be discussing. And this is what is known as a brain natriuretic peptide. Brain natriuretic peptide. So, for the brain natriuretic peptide known as the BNP, okay, let's quickly look at it. Okay, so BNP. Okay, so they say brain, but funny enough, is linked to the heart. Yes, that's the funniest thing. So, brain natriuretic peptide is a hormone released by the heart. So, initially they thought it was the brain. That's why they named it brain natriuretic peptide. But later on, they discovered that it's the heart, but they didn't change the name. So, usually released by the heart when the heart is stressed. Okay. So, usually when they do blood test and they see that it is high, it usually shows that probably there's any heart condition, especially heart failure. So elevated levels are usually used to see that okay, the heart is struggling to keep up with pumping blood to your various systems. So brain natriuretic peptide is a hormone produced mainly by the ventricles of the heart. Despite of the name, it's not linked to the brain. It was first discovered, okay, in the brain. So they felt it was the brain producing it, but no, the heart produced it and it circulated to the brain. So function, it helps to reduce the workload on the heart. The heart is reducing it that hey, I'm stressed, come and help me. So it widens the blood vessels, it promotes the kidneys to put out more fluid or urine, thereby reducing the blood pressures or the pressures on the heart. So I think this is just what we got for this, you know. So the test overview. If they are doing any test for brain natriuretic peptide, is mainly to check if the heart is having issues or failing. So it's a simple blood test and they take the blood right from the vein. Okay. So what are the normal ranges when they test for it now? Um, Normal levels should be lower than 100 picograms per mils, but anything more than 400 picograms per mils shows you that there's heart failure likely. Okay. So age specific cutoffs include, well, that's just by the way, right? Just take the first ones. Okay, let's not complicate things. But if you see the levels high, it's associated with heart failure, coronary artery disease, atrial fibrillation, valve disease, that's heart related. Sometimes it can also be released when other organs are stressed, like kidney failure, lung disease, like COPD, pulmonary embolism, liver disease, sepsis, you know. So clinical uses. Um, it can be used to diagnose, so distinguish heart failure from other causes of shortness of breath. Also can be used in assessing severity. Also monitoring, like as you are treating someone, you're also testing to see if the person is recovering or not. Okay.